my name is Connor Howes and today I'll be completing Practical Assessment 8, Barrier Nursing. So before I've begun, I have washed my hands under warm soapy water for at least 20 seconds and I have gathered all of the appropriate equipment here required for today's video. So this is Lola Smith here. She's an 8-year-old female Spay Jack Russell Terrier in today for a suspected kennel cough. We have our specific hospital chart here, a dedicated isolation-only fluid line ready to go for Lola, and 3 bins specifically ready for isolation only for disposal of the correct clinical waste for her. I have a fresh towel all lined ready to go because this is where we'll be placing her for a physical exam. All of this isolation-only specific equipment which stays in the isolation suite at all times with the stethoscope and a slip lead to get her out. Demarcation is essential to prevent the spread of zoonotic diseases. It helps to prevent cross-contamination within the clinic and helps to protect healthy or immunosuppressed or immunocompromised patients that are otherwise being treated within the hospital. It maintains a closed-off environment that can be warded off for cleaning, disinfecting, and waste disposal, and helps to prevent the risk of pathogens becoming airborne or spreading. Additional precautions above PPE which must be met when handling an infectious patient, especially one with zoonotic potential, is to ensure the isolation suite is located in a low-trafficked area, to limit access to and from the isolation suite, to ensure that a one nurse, one vet dedicated team has been devised to handle all of the isolation patients for that day, to ensure that they aren't coming into contact with any of the other healthy or immunocompromised patients that are within clinic, and to ensure that we have dedicated isolation-only equipment which is used, cleaned, and stored back in isolation only and is kept only within isolation and does not come out for any other purposes within the other treatment area within the hospital. And to ensure that the isolation suite is in a relatively easy location that allows for them to have a quiet recovery, however to have easy access to them so they can be monitored regularly. So before we begin, we want to use some alcohol-based hand sanitizer here to appropriately clean our hands, or we could wash our hands under warm soapy water using soap just to maintain our hand hygiene. So to begin, and in the appropriate order, we want to start with the gown. We want to start by touching the collar only and giving it a good shake out to allow the armholes easy access. Usually at this stage, I would have a nurse assistant to help me don on the gown. However, I am filming this video assessment by myself, so I will just be applying it all. And we have the gown completely covering the neck all the way to the arms. Next, we want to apply the mask. We want to make sure that it is snugly fitting over the mouth and the nose, as this helps to protect from any airborne pathogens. Next, we'll don on this surgical scrub cap. Ideally, we'd like to use disposable hairnets, however, our clinic doesn't have any available, and I will just be demonstrating with the scrub cap here. It is ideally you want disposable ones as it is isolation, and you want to be discarding all of that PPE at the end of the procedure. Next, our clinic doesn't have any safety glasses available. However, I will just be using the wound laser goggles as a simulated PPE device just to show you that it would be next. So now, essentially, I have created a microbial barrier from the neck all the way to my knees, so I am not coming into contact with any infectious agents. I have appropriately donned on all of the PPE here now, and then I will now demonstrate how to set up the foot bath for isolation. I'm just going to remove the safety glasses now just because they are fogging up and I would like to see. To set up the foot bath appropriately, we want to have all of our equipment ready to go. Our clinic uses chlorhexidine gluconate 4% at a dilution rate of 12 mils is to 1 litre of water. We will be requiring 2 litres of water, so I have got 24 mils of chlorhexidine gluconate drawn up in a pre-drawn syringe. I have a clean foot bath which has been wiped out clean and is ready to go. You can also use Virkon as a pre-oxygen compound, which is ideal for setting up a foot bath. However, our clinic doesn't have any at the moment, and we will be using chlorhexidine. It is less efficacious than Virkon, so the foot bath will need to be changed a lot more regularly when in clinic. So, to begin, we first want to fill up to the 2 litre marking on the measuring cup. We want to squeeze it all directly into the foot bath. 2 litres of warm running water there. We'll place that into the chlorhexidine solution, which I've just placed in. And now that foot bath is all ready to go. I will then place this one at the front here at the entrance of the isolation suite. When entering the isolation suite, we must always immerse our soles of our shoes fully into the foot bath before stepping into the isolation suite. This means that we must allow the sole to coat completely within the foot bath before stepping in. So as it is a small foot bath, it only allows for one foot to be immersed at one time. So we just do that now, just coating the bottom and then stepping into the isolation suite. Being very careful not to touch any of the doors, walls, surfaces or anything around you as you do that. Making sure that the foot is completely immersed. Close the door behind us to reduce any of that contaminants from spreading from one adjacent area into the other within the treatment hospital, and to close the door behind us. As she is an isolated case, want to just be very wary of her physiology, her behaviour, make sure that we are using low stress handling at all times and monitoring her canine body movements. So we'll quietly open the enclosure door now, gently placing it over her head there and removing her from the enclosure using the same handling technique that you would be for a non-infectious patient, making sure that we have one hand coming under her thorax and we are maintaining her hind area there, making sure we have complete and good control. This is usually where we perform our physical exams on our infectious patients to ensure that we aren't cross-contaminating or going into any other treatment areas that is unnecessary. We'll check her heart rate as such. Her heart rate is quite high there. I can hear that she's going quite tachycardic just because she is quite stressed and her condition has been exacerbated by the cough. Monitor her rest rate, which I am doing now, prior to the temperature, as we don't want to elevate that respiration rate. And now notice the light pant there of about 40 for the rest rate. I know, it's a little stressful, it's a little uncomfortable as well. You're doing such a good job, Lola. And fantastic, I have a reading there of 38.1. That will then get placed to the side and that will also be cleaned separately. I've got good control of her. She's not coming into contact with me in any way. I am completely covered because of the PPE and I'll just safely return her now to her enclosure. So, dropping down to her knee, making sure that she is calm and comfortable and monitoring her reaction as well after handling. It is very important as well that when removing a patient that is in isolation for a physical exam, that it is done in a timely and efficient manner, as we want to limit the amount of time that they are spending outside of the cage. So our clinic uses Safe 4 disinfection as our main disinfection protocol, and we use V-wipes as our main cleaning clinical protocol. All of this equipment stays within the isolation suite and does not get removed at any time for any reason, as this is isolation only. So before we begin, we want to open and get a fresh V-wipe out. Making sure that we are cleaning the stethoscope methodically. Want to be making sure that no areas are missed, no surfaces are missed. I will get out another V-wipe. As we are going from different pieces of equipment, it is ideal that we use different V-wipes for different pieces of equipment to reduce the risk of cross-contamination spreading. And this will now get placed away into the isolation-only equipment. I will then discard that into the infectious rubbish bin. We have all of our linen bedding, the appropriate size muddles that we use, and the slip lead. Now all of this will need to be removed and washed and dried separately in a separate load from any of the other clinical linen that is being washed. We'll be wiping the top of the enclosure, which we used here as our table. Then using our Safe for disinfection protocol, we want to generously spray the table with the disinfectant, allowing it to sit for a 10 to 15 minute contact time as per the manufacturer's recommendation before wiping away that residual with paper towel. Now, as we are exiting the isolation suite, we want to be very careful not to touch any of the other walls or surfaces or doors around us. We want to be using our elbows to open the door and making sure that we are not coming into contact with any of the surrounding area. We then want to gently step out, making sure that we are immersing our foot again into the foot bath below, allowing the sole of the foot to be immersed in the disinfectant solution as such before stepping out. We first want to remove the gloves and gown together. To do that, you untie the tie to the right, pop off the Velcro, and in one swift movement, you want to pull the gown and the gloves off together. We want to safely discard that into the biohazard bin here, which is located to the right. We want to perform hand hygiene in between each item of PPE that we removed. Next, we would have removed the goggles as well, and then hand sanitizer. We want to remove our hairnet, be washed and dried separately, which I will place with the other infectious items. Place that to the side. Then maintain our hand hygiene in between. And finally, we want to remove the mask as our last piece of PPE equipment and perform a hand hygiene. But other than that, that is everything today. That is ACVN, Practical Assessment 8, Barrier Nursing.